Hi, my name is Greg Evans. I'm a practicing pediatric dentist in Fort Collins, Colorado. The question you asked is very astute and one that I wish more parents would ask. Surprisingly, a lot of dentists get in the groove of taking x-rays every 6 months and they don't waver from that. But x-rays should be based on how often they're necessary to screen for cavities. And how often they're necessary depends on a child's cavity risk. Cavity risk, or the caries risk assessment, should be done on every patient every time. For children that are in a high to medium risk categories, it's appropriate to take x-rays every 6 months. Cavity risk depends on diet, it depends on brushing frequency, it depends on the ability to brush properly, it depends on fluoride use, water fluoridation, it depends on a child's age, a child's disability, saliva content. So there's many different factors that go into a dentist deciding what risk a child is. As an example, a child that has a cavity 6 months ago and comes in today to my office with very good hygiene would still need x-rays, and what those x-rays would be doing would be to screen for any recurrent decay. X-rays are also a good way to determine is progress being made or do we need to change our strategies. Another scenario might be a child that had a cavity say 2 years ago but that came in and had brushing that was very poor. Their cavity risk, their past cavity risk was very low, but their hygiene was very poor, which puts them in a higher risk category, and x-rays every 6 months until that approved would be good. Children that are low risk have not had a cavity within the past 2 years. They've got good hygiene or they've got good supervision. They're using fluoride in their toothpaste and in their water. And in that case, I would recommend that cavity detecting x-rays, or the small bite wing x-rays, are being taken every 12 to 18 months. For children, a cavity needs to progress from the outside of the tooth all the way into the body of the tooth on average in about 1 year's time. So if you're taking cavity detecting x-rays about that interval, you're going to catch cavities before they develop. Now with adults, or an adult teeth, that interval is very different. It's about 2 to 3 years from the outside of the tooth into the body of the tooth, and it could be even longer. So for adults, taking x-rays every 18 months or every 2 years is probably more appropriate for the low-risk adult. And a lot of my patients in my practice, when they get to be 15, 16, 17 years old, we cut back on their x-rays tremendously. So the answer to your question is how often should I get my x-rays is what is my child's cavity risk? And the dentists that you go to need to answer that question definitively with evidence. Dentistry needs to become more evidence-based, and that's why we need to have these systematic things written down. So often, the way dentistry has been practiced is we get x-rays every 6 months and we get fluoride treatments every 6 months because that's the way it's always been done. And that's not the way to do modern dentistry. The bottom line for x-rays is that they are expensive and they use radiation. Now, dental x-rays, the production of the radiation that they produce to take those is very, very low. In fact, it's on the order of 2 x-rays is about the same amount of radiation as spending a few hours in the sunshine in Colorado. For more detail on this question, or if you would like answers to other questions you may need to know, please go to my website at www.biggrinswithdrgreg.com or email me. I love what I do, and I would love to help you raise healthy, happy children. Thanks for tuning in.